Treatment of poisoning. Toxicology is the study of poisons, their actions, detection, prevention, and treatment of poisoning. All poisoning cases requires hospitalization and careful observation till recovery. Poisoning may be suicidal, homicidal, or accidental. All cases of poisoning are medico-legal cases, hence the police should be informed. General management. First, hospitalization. Second, airways should be cleared. In comatose patient, there is danger of respiratory obstruction by tongue, secretions, and aspiration of vomitus. Hence, patient should be turned to his left lateral side. A cuffed endotracheal tube should be inserted and secretion should be aspirated regularly. Third, breathing should be assessed. If there is hypoxemia, oxygen should be given. Patient may need mechanical ventilation if there is respiratory insufficiency. Fourth, circulation should be assessed, pulse rate and blood pressure, and intravenous lines should be maintained. Fifth, to prevent further absorption of poisons, in case of inhaled poisons such as gases, patient should be moved to fresh air. In case of contact poisons, contaminated clothes should be removed and body part should be washed with soap and water. In case of ingested poisons, gastric lavage can limit the absorption if done within 2 to 3 hours of poisoning. If patient is unconscious, endotracheal intubation should be done before gastric lavage. Gastric lavage is usually done with normal saline. Other solutions used are lukewarm water, potassium permanganate solution, sodium bicarbonate, etc. Lavage should be repeated till the returning fluid is clear. After the lavage, activated charcoal is administered, which absorbs many drugs and poisons. Activated charcoal has a large surface area and is highly porous to bind with poisonous material. Gastric lavage should not be carried out in case of poisoning due to corrosives, petroleum products, convulsants, etc. Mustard, common salt, syrup ipecac, etc. can be used to induce vomiting and prevent further absorption of the ingested poisons. However, this method is rarely practiced now. Laxatives like magnesium sulfate can be used orally to promote elimination of the ingested poisons. Oral polyethylene glycol electrolyte should be used for whole bowel irrigation of the gastrointestinal tract in case of poisoning due to iron, lithium, cocaine, heroin, foreign bodies, etc. Sixth, to promote eliminations of the absorbed portion of the drug, diuretics are used to promote elimination of the absorbed portion of the drug. Renal elimination of some of the drug can be increased by altering the pH of urine. Example, alkalinization of the urine in salicylate poisoning and acidification of urine in amphetamine poisoning. Dialysis is used in cases of severe poisoning. Example, lithium, aspirin, methanol, etc. 7. Symptomatic treatment. Intravenous diazepam 5 to 10 mg if there are convulsions, external cooling for hyperpyrexia. 8th, maintenance of the fluid and electrolyte balance. Hyponatremia should be treated with intravenous normal saline and hypernatremia should be treated with intravenous furosemide. Hypokalemia is treated with potassium chloride, oral or slow intravenous infusion. Oral potassium chloride should be diluted in tumbler of water to prevent intestinal ulceration. Potassium chloride should be given slow intravenously as it has a cardiac depressant effect. Rapid injection can cause cardiac arrest and death. Thiazides or furosemide can be used to treat mild hyperkalemia. Severe hyperkalemia is treated with 10% calcium gluconate intravenously. Intravenous sodium bicarbonate is used to treat metabolic acidosis. Note: mnemonic for general management of poisoning is A2H, specific management. Antidotes for various poisons. For alkalis poison, antidote is dilute acetic acid. For organophosphorus compounds poisoning, antidote is atropine. For morphine poisoning, antidote is naloxone. For atropine poisoning, antidote is physostigmine. For benzodiazepines poisoning, antidote is flumazenil. For carbamates poisoning, antidote is atropine. For cyanide poisoning, antidote is sodium nitrite and sodium thiosulfate. For methanol poisoning, antidote is ethyl alcohol. Fomepizole. For paracetamol poisoning, antidote is N-acetylcysteine. For heparin poisoning, antidote is protamine sulfate. For warfarin poisoning, antidote is vitamin K1 phytonadione. For iron compounds poisoning, antidote is desfriazamine. Poison Information Centers. WHO has established poison information centers in AIIMS, New Delhi, and Ahmedabad. Computer software on poisons is used in these centers. Regional centers are in Chennai and Kochi. These centers provide information about toxicity assessment and treatment over the phone throughout the day.